Question 1. Scenario-based question. Mr. Thompson, an infection control practitioner at the hospital, is investigating an outbreak of respiratory infections in the hospital's intensive care unit ICU. He notices that most cases are among immunocompromised patients. After reviewing patient records, he identifies commonality. The infections tend to occur after the use of specific ventilator equipment in the ICU. Given this situation, Mr. Thompson should take the following action to address the outbreak. What should be his next step? A. Continue using the ventilator equipment, but advise the ICU staff to increase hand hygiene measures. B. Immediately remove the ventilator equipment from use and implement an investigation into the source of infection. C. Increase the use of antibiotics among patients in the ICU to control the spread of infections. D. Report the outbreak to the local health department and continue normal operations. Answer. B. Immediately remove the ventilator equipment from use and implement an investigation into the source of infection. Explanation. In this scenario, Mr. Thompson identifies the ventilator equipment as a potential vector for infection. Infection control measures mandate the immediate removal of any suspected contaminated equipment to prevent further transmission. The investigation should focus on identifying the source of the infection, ensuring that thorough assessment of the equipment, its cleaning and maintenance procedures is conducted. The CDC and WHO guidelines emphasize the importance of isolating the cause of an outbreak and preventing further exposure, rather than relying solely on hand hygiene or antibiotics, which address symptoms but not the underlying source. Antibiotics may not be the solution if the root cause lies with the equipment itself. Question 2. Which of the following is the most effective method for preventing the spread of healthcare-associated infections? Highs in a hospital setting. A. Proper hand hygiene before and after patient contact. B. Administration of broad-spectrum antibiotics to all patients. C. Routine use of contact precautions in all hospital areas. D. Increasing the use of disinfectants for surface cleaning only. Answer. A. Proper hand hygiene before and after patient contact. Explanation. Hand hygiene is the cornerstone of infection prevention and control in healthcare settings. The CDC and WHO recommend hand hygiene as the most effective method to prevent the transmission of pathogens. Regular hand washing with soap and water or the use of alcohol-based hand sanitizers significantly reduces the spread of microorganisms, especially between interactions, while the use of antibiotics and disinfectants plays a role in controlling infections. They are not as universally effective as proper hand hygiene. Broad-spectrum antibiotics should not be overused as they contribute to antimicrobial resistance. Contact precautions and surface cleaning are important but are secondary to the foundational practice of hand hygiene. Question 3. When conducting an infection control audit in a hospital setting, which of the following actions would most effectively address a high-risk area identified in the audit? A. Introduce additional staff training on infection control measures and increase hand hygiene audits. B. Issue an immediate mandate to suspend all surgeries until the infection risk is eliminated. C. Perform regular, routine cleaning but make no changes to existing infection control policies. D. Recommend that all patients wear masks to reduce the spread of infection. Answer. A. Introduce additional staff training on infection control measures and increase hand hygiene audits. Explanation. When conducting an infection control audit, the goal is to identify and mitigate risks associated with infection transmission. Training staff on proper infection control practices such as hand hygiene, personal protective equipment (PPE) usage, and cleaning protocols is critical in addressing high-risk areas. Increasing hygiene audits ensures ongoing compliance and provides continuous monitoring of infection control practices. Issuing an immediate suspension of surgeries, option B, may be unnecessary unless there is clear evidence of contamination. Routine cleaning without changes, option C, does not address the core issue. Recommending masks for patients, option D, is not a primary strategy for infection control, especially without addressing staff practices and environmental cleanliness. Question 4. An infection control practitioner in a healthcare facility has noticed a rising number of infections in patients who have undergone surgical procedures. Upon further investigation, she discovers that the sterilization process for surgical instruments has not been consistently followed, and some instruments have been reprocessed using inadequate methods. Which of the following steps should be taken to address this issue? A. Implement an immediate policy to discontinue surgeries until sterilization procedures are properly reviewed and corrected. B. Provide additional training to staff on proper sterilization techniques but allow surgeries to continue as usual. C. Perform routine surveillance for surgical site infections, assist but take no immediate corrective action regarding sterilization procedures. D. Issue a memo to staff about the important sterilization but defer the implementation of any new procedures until a formal audit can be conducted. Answer A. Implement an immediate policy to discontinue surgeries until sterilization procedures are properly reviewed and corrected. Explanation. The safety of surgical patients depends heavily on the proper sterilization of instruments to prevent infections, particularly surgical site infections. SS. The CDC and WHO guidelines for infection control emphasize that inadequate sterilization methods put patients at significant risk for infection. Discontinuing surgeries until sterilization procedures are reviewed and corrected is crucial to prevent further infections and ensure patient safety. Allowing surgeries to continue with known issues, option B, or performing surveillance without addressing the underlying problem, option C, would exacerbate the risk of SS. A memo alone, option D, does not resolve the critical issue of inadequate sterilization procedures, which require immediate corrective action. Question 5. In the context of an outbreak investigation, an infection control practitioner is tasked with determining the source of a potential viral infection in a hospital. After identifying a cluster of cases among patients in the same ward, the practitioner hypothesizes that the virus might have spread through contaminated air conditioning units. Which of the following actions should be taken to confirm this hypothesis and prevent further transmission? A. Isolate affected patients and disinfect all air conditioning units immediately. B. Conduct environmental testing for air contaminants and evaluate HVAC system maintenance records. C. Advise the staff to increase the use of PPE for all patients and staff members in the ward. D. Report the suspected outbreak to the local health department and continue daily cleaning protocols. Answer. B. Conduct environmental testing for air contaminants and evaluate HVAC system maintenance records. Explanation. To confirm the hypothesis that the HVAC system is involved in the outbreak, the infection control practitioner should first conduct thorough environmental testing for airborne pathogens. This includes evaluating the maintenance records of the HVAC system to ensure that it is properly functioning and has not been contamination. Isolating patients and disinfecting the HVAC system, option A, may not address the root cause without further investigation. Increasing the use of PPE, option C, is important but may not prevent the spread if the environmental source is not identified and controlled. Reporting the outbreak, option D, is essential but premature unless the source of transmission is confirmed. Question 6. A healthcare facility has seen an increase in multi-drug-resistant MDR infections among patients, particularly in the ICU. The infection control practitioner is concerned about the potential for antimicrobial resistance AMR to escalate further. Which of the following strategies should the facility implement to address AMR and improve infection control practices? A. Implement a strict policy of restricting the use of all antibiotics in the ICU for all patients, regardless of diagnosis. B. Strengthen antimicrobial stewardship by ensuring appropriate antibiotic use, regular audits, and educating staff on resistance risks. C. Increase the frequency of patient hand hygiene training but allow for continued unrestricted antibiotic use in all patients. D. Administer broad-spectrum antibiotics to all ICU patients to preemptively manage possible infections. Answer. B. Strengthen antimicrobial stewardship by ensuring appropriate antibiotic use, regular audits, and educating staff on resistance risks. Explanation. Antimicrobial resistance AMR is a serious concern in healthcare settings, particularly in areas like the ICU, where patients are often exposed to invasive procedures and antibiotics. The most effective strategy to combat AMR is to implement an antimicrobial stewardship program. Focuses on appropriate antibiotic use, regular audits of antibiotic prescribing practices, and educating healthcare staff on the risks of resistance. Restricting antibiotics in all cases, option A, or administering broad-spectrum antibiotics indiscriminately, option D, could worsen resistance. Increasing hand hygiene training, option C, is beneficial, but it does not address the root cause of AMR, which lies in antibiotic misuse. Question 7. During an outbreak of gastrointestinal illness in a long-term care facility, the infection control practitioner notices that the transmission of the illness may be occurring through contaminated food and surfaces. Which of the following steps should be prioritized to prevent further spread of the infection? A. Quarantine all staff and patients in the facility and disinfect all surfaces immediately. B. Identify and isolate infected patients, implement enhanced cleaning protocols, and review food handling practices. C. Increase patient intake of fluids and administer antibiotics to all affected individuals. D. Reorganize patient care teams to minimize contact between staff and infected patients while continuing normal practices. Answer: B. Identify and isolate infected patients, implement enhanced cleaning protocols, and review food handling practices. Explanation: to control the spread of gastrointestinal infections in a long-term care facility, the infection control practitioner should first identify and isolate affected patients to prevent further transmission. Enhanced cleaning protocols should be implemented, focusing on high-touch surfaces, food handling areas, restrooms. Reviewing food handling practices is critical as contaminated food can be a major source of transmission. Quarantining staff and patients, option A, may not be necessary unless transmission is confirmed to be widespread. Increasing fluid intake, option C, is a supportive measure, but it does not address the source of infection. Reorganizing patient care teams, option D, without addressing food handling and cleaning issues would not control the outbreak. Question 8. A hospital is preparing for an accreditation review by the Joint Commission, and the infection control practitioner is tasked with ensuring compliance with infection prevention and control standards. Which of the following strategies will best help the hospital achieve full compliance? A. Conducting a self-audit of infection prevention practices and correcting any identified gaps before the review. B. Increasing staff awareness of infection prevention measures through newsletters and email communication. C. Scheduling extra training sessions for staff on infection control topics in the week leading up to the review. D. Relying solely on the infection control manual and policies without making any additional changes to current practices. Answer A. Conducting a self-audit of infection prevention practices and correcting any identified gaps before the review. Explanation: to achieve full compliance with the Joint Commission's infection prevention and control standards, self-audit should be conducted to identify any gaps or weaknesses in current practices. This proactive approach allows the hospital to address issues before the formal review. The audit should assess staff adherence to protocols, effect of cleaning procedures, and compliance with hand hygiene and PPE usage. Increasing staff awareness through newsletters, option B, and training in the week before the review, option C, is useful but may not be sufficient without comprehensive review of practices. Relying solely on existing documentation, option D, without assessing implementation and effectiveness does not ensure full compliance. Question 9. An infection control practitioner. A dental office is concerned about the potential spread of infections due to improper sterilization of dental instruments. After reviewing the sterilization procedures, he finds that some instruments are not being properly sterilized, particularly high-risk items such as handpieces and scalers. Which of the following measures should the practitioner take to address this concern? A. Immediately stop using high-risk dental instruments until the sterilization procedures are corrected. B. Increase the frequency of sterilization checks, but allow staff to continue using the same sterilization methods. C. Introduce more PPE for dental staff but make no changes to the sterilization process. D. Educate patients on the risks of infections but take no corrective action regarding the instruments. Answer A. Immediately stop using high-risk dental instruments until the sterilization procedures are corrected. Explanation: when an infection control practitioner identifies issues with the sterilization of high-risk dental instruments, immediate action must be taken to stop their use until the sterilization procedures are corrected. This aligns with CDC guidelines, which emphasize that improper sterilization puts patients at significant risk of infection. Allowing continued use of inadequately sterilized instruments, option B, or relying on PPE alone, option C, does not address the root cause of infection risk. Educating patients, option D, is important, but it does not resolve the immediate issue of contaminated instruments in the dental setting. Question 10. A hospital has noticed an increased rate of bloodstream infections, BCS, among patients who have central venous catheters, EVCS, in place. After reviewing infection control practices, the infection control practitioner identifies that the rate of proper catheter maintenance and dressing changes is lower than recommended. Which of the following actions should the hospital take to reduce the incidence of BCS? A. Conduct immediate re-education for all healthcare staff on catheter maintenance and dressing change procedures. B. Restrict the use of EVCS in high-risk patients and avoid catheter insertion whenever possible. C. Implement A checklist-based protocol to ensure proper catheter care, including hand hygiene and dressing changes at the time of insertion and during follow-up care. D. Advise patients and their families to monitor and clean catheters at home to improve infection prevention efforts. Answer. C. Implement a checklist-based protocol to ensure proper catheter care, including hand hygiene and dressing changes at the time of insertion and during follow-up care. Explanation. A checklist-based protocol ensures that essential infection control steps, such as proper hand hygiene, aseptic techniques during insertion and dressing changes, are consistently followed. This systematic approach is proven to reduce the rate of bloodstream infection. BCIS. While re-education, option A, is necessary, it is more effective when part of structured protocol. Restricting the use of EVCS, option B, might not be feasible or necessary if proper care procedures are followed. Advising patients and families to monitor and clean catheters at home, option D, could lead to inconsistent practices, and catheter maintenance should be under the supervision of trained healthcare staff. Question 11. An infection control practitioner is investigating an outbreak of respiratory infections in a long-term care facility. The practitioner discovers that the infections are mainly affecting patients who share a common air ventilation system. After reviewing infection control procedures, the practitioner realizes that the ventilation system has not been adequately maintained. What should the practitioner's next step be in managing the outbreak? A. Begin antibiotic treatment for all residents, regardless of whether they are symptomatic. B. Immediately implement enhanced air filtration systems and conduct an audit of the HVAC system. C. Restrict all visitors to the facility to reduce exposure but allow the ventilation system to remain unchanged. D. Report the outbreak to the CDC and wait for their instructions before taking further action. Answer. B. Immediately implement enhanced air filtration systems and conduct an audit of the HVAC system. Explanation. The source of the respiratory infections seems to be related to the facility's air ventilation system. The infection control practitioner should prioritize improving the air filtration and conducting an audit to assess the system's function and maintenance. This proactive action can help contain the outbreak and prevent further transmission. Antibiotic treatment may be appropriate for symptomatic patients. Option A. It does not address the environmental source of the infections. Restricting visitors, option C, is important but insufficient if the ventilation system is the cause. Reporting to the CDC, option D, is a necessary step, but immediate corrective actions should take priority to prevent additional infections. Question 12. A healthcare facility is seeing an uptick in antibiotic-resistant infections, particularly with Clostridium difficile. C. difficile. The infection control practitioner is tasked with addressing this problem and preventing further spread. Which of the following strategies would be most effective in reducing C. difficile infections? A. Increase the use of broad-spectrum antibiotics across all patient populations. B. Implement an infection control policy focused on environmental cleaning and disinfection, especially in high-risk areas like bathrooms and patient rooms. C. Discontinue antibiotic use entirely until the outbreak is under control. D. Recommend probiotics for all patients to prevent C. difficile infections. Answer. B. Implement an infection control policy focused on environmental cleaning and disinfection, especially in high-risk areas like bathrooms and patient rooms. Explanation. C. Difficile infections are often associated with healthcare settings and they can be spread through contaminated surfaces and improper environmental cleaning. The most effective strategy involves improving environmental cleaning, especially in areas where spores may survive, such as bathrooms and patient rooms. Broad-spectrum antibiotics, option A, can contribute to antibiotic resistance and worsen the problem. Discontinuing antibiotics entirely, option C, is not feasible and may harm patients who need treatment. Probiotics, option D, have some potential benefits but should not be the primary strategy for controlling C. difficile outbreaks. Question 13. A hospital infection control team is investigating a surge in surgical site infections, SIS, among patients undergoing orthopedic surgery. The team identifies that the infection rates are higher in the surgical unit with a history of inadequate air quality control. What should be the infection control team's next course of action? A. Continue with current practices and monitor the infection rate over time. B. Improve air filtration systems in the surgical units and conduct environmental assessments to ensure compliance with guidelines. C. Discontinue orthopedic surgeries until the source of infections is identified. D. Ask surgical staff to increase the use of personal protective equipment, PPE, during surgeries. Answer: B. Improve air filtration systems in the surgical units and conduct environmental assessments to ensure compliance with guidelines. Explanation: surgical site infections (SIS) can be caused by environmental factors including poor air quality. Improving air filtration and ensuring compliance with infection control guidelines, such as maintaining a clean surgical environment, is critical. Monitoring the infection rate over time, option A. Important, but immediate corrective action is needed to prevent further SIS. Discontinuing orthopedic surgeries, option C, may not be necessary if the issue can be addressed with improved environmental controls. Increasing PPE usage, option D, alone would not address the underlying environmental problem. Question 14. A hospital infection control practitioner is conducting a routine audit of healthcare-associated infections, HIEs, and discovers that a significant number of infections are occurring in patients who have undergone invasive diagnostic procedures. What steps should the infection control practitioner take to reduce the incidence of HIEs related to these procedures? A. Ensure that all diagnostic procedures are immediately cancelled until the infection control practices are improved. B. Implement a targeted infection prevention program that includes proper aseptic techniques, sterile equipment, and post-procedure care. C. Educate patients to monitor for infection signs post-procedure and report any issues to the healthcare provider. D. Rely on the hospital's existing infection control policies with introducing any new measures. Answer: B. Implement a targeted infection prevention program that includes proper aseptic techniques, sterile equipment, and post-procedure care. Explanation: to reduce the incidence of infections after invasive diagnostic procedures, a targeted infection prevention program is necessary. This program should focus on ensuring the use of proper aseptic techniques, sterile equipment, and appropriate post-procedure care, while patient education options. Important, it cannot replace the need for staff adherence to infection prevention protocols. Cancelling procedures, option A, would be impractical and could harm patients. Relying on existing policies without further intervention, option D, is insufficient if the current practices are not preventing infections. Question 15. A healthcare facility has had several cases of influenza among patients during peak flu season, and the infection control practitioner is concerned about a potential outbreak. The facility has an existing vaccination program, but vaccine uptake is lower than expected. What steps should the infection control practitioner take to increase vaccination rates and prevent further spread of the flu? A. Provide flu vaccinations to staff and patients during regular shifts and actively educate them on the importance of vaccination. B. Mandate flu vaccination for all staff and patients with no exceptions, regardless of medical contraindications. C. Focus on treating influenza symptoms in infected patients rather than focusing on prevention strategies. D. Post signs around the facility encouraging staff and patients to get vaccinated, but take no further action. Answer: A. Provide flu vaccinations to staff and patients during regular shifts and actively educate them on the importance of vaccination. Explanation: increasing flu vaccination rates requires both access to the vaccine and effective education on its importance in preventing outbreaks. Offering vaccinations during regular shifts and educating staff and patients can encourage greater participation. Mandating vaccinations, option B, could face resistance and may not be feasible in certain situations. Focusing only on treatment, option C, does not address the prevention of flu outbreaks. Posting signs, option D, may increase awareness but does not actively promote vaccination or address barriers to uptake. Question 16. A long-term care facility has seen a rise in skin and soft tissue infections (STIs) among residents, particularly those with chronic conditions like diabetes. The infection control practitioner is reviewing the facility's infection prevention protocols and notices gaps in wound care practices. What should be the first action the infection control practitioner takes to address these gaps? A. Increase the frequency of wound care audits and provide targeted training for staff on proper wound care techniques. B. Recommend that all residents with chronic conditions receive daily antibiotic prophylaxis. C. Discontinue all chronic care management until the wound care protocols are completely overhauled. D. Suggest that residents and their families take over wound care duties to reduce the burden on staff. Answer: A. Increase the frequency of wound care audits and provide targeted training for staff on proper wound care techniques. Explanation: Proper wound care practices are crucial for preventing infections, especially in patients with chronic conditions that may impair healing. Increasing the frequency of wound care audits and providing targeted staff training ensures that proper techniques are followed consistently. Daily antibiotic prophylaxis, option B, not necessary for all residents and could contribute to antibiotic resistance. Discontinuing chronic care management, option C, would harm residents and is unnecessary. Asking residents and their families to take over wound care, option D, is not a sustainable solution and places undue burden on individuals who may not be trained. Question 17. A hospital infection control team has identified that a significant number of healthcare-associated infections are being transmitted through contaminated medical devices. The team is investigating which devices are most commonly associated with these infections. Which of the following steps should the team take first to prevent further transmission through medical devices? A. Discontinue the use of all medical devices until the investigation is complete. B. Perform a full audit of medical device reprocessing and sterilization protocols with a focus on high-risk devices. C. Educate patients on the potential risks of medical devices and encourage them to report any infections. D. Reassign healthcare staff to different units to minimize exposure to contaminated medical devices. Answer. B. Perform a full audit of medical device reprocessing and sterilization protocols with a focus on high-risk devices. Explanation. A comprehensive audit of the reprocessing and sterilization protocols for medical devices is the first step in identifying and addressing gaps in infection prevention practices. High-risk devices, such as catheters and surgical instruments, require particular attention. Discontinuing the use of all devices, option A, is impractical and could compromise patient care. Educating patients, option C, is important but should not replace a systematic investigation. Reassigning healthcare staff, option D, does not address the root cause of the issue and does not prevent the transmission of infections. Question 18. A hospital infection control team is investigating a cluster of infections caused by a multidrug-resistant organism (EDRO) among patients in the oncology ward. The team suspects that the infections are related to the improper use of antibiotics and inadequate infection prevention practices. What should the team's next steps be to address this outbreak? A. Perform an environmental cleaning and disinfection of the oncology ward but continue the use of antibiotics. B. Implement an antimicrobial stewardship program, review antibiotic prescribing practices, and conduct additional staff training on infection prevention. C. Isolate affected patients and stop all admissions to the oncology ward until the outbreak is under control. D. Discontinue all antibiotic use in the oncology ward and rely on infection prevention measures alone to control the outbreak. Answer. B. Implement an antimicrobial stewardship program, review antibiotic prescribing practices, and conduct additional staff training on infection prevention. Explanation. An antimicrobial stewardship program is critical in managing EDROs by ensuring that antibiotics are used appropriately and not overprescribed. Reviewing antibiotic practices and providing additional staff training on infection prevention are key components. Strategy. Environmental cleaning, option A, is necessary but insufficient if antibiotic overuse continues. Isolating patients and halting admissions, option C, may be necessary in severe cases but is not the first step to address the underlying issue. Discontinuing all antibiotics, option D, could harm patients who need them for non-infectious conditions and is not a comprehensive approach. Question 19. A hospital is facing an outbreak of norovirus among patients in the emergency department. The infection control team has identified that the virus is likely being spread through contaminated surfaces, especially in high-touch areas such as waiting rooms and restrooms. Which of the following actions should the infection control team prioritize to limit the spread of the virus? A. Increase the frequency of environmental cleaning in high-touch areas and provide hand sanitizers throughout the department. B. Restrict all patients from entering the emergency department unless absolutely necessary. C. Begin providing antiviral medications to all patients presenting with symptoms of norovirus. D. Limit visitation to only immediate family members to prevent further exposure. Answer A. Increase the frequency of environmental cleaning in high-touch areas and provide hand sanitizers throughout the department. Explanation. Norovirus is highly contagious and can be transmitted through contaminated surfaces. The most effective way to limit its spread in a healthcare setting is to increase the frequency of cleaning, especially in high-touch areas, and to provide hand sanitizers to reduce the likelihood of transmission. Restricting patients B is not practical and could delay care. Providing antiviral medications, option C, is not effective against norovirus as it is a viral infection that typically resolves on its own. Limiting visitation, option D, may help reduce exposure but is not a comprehensive approach to infection control. Question 20. A healthcare facility is experiencing an increased number of urinary tract infections, UTIs, in patients who have indwelling urinary catheters. The infection control practitioner identifies that the infections are likely being caused by improper catheter care and lack of adherence to hygiene protocols. What should the infection control practitioner's next course of action be to reduce the UTI incidence? A. Immediately remove all indwelling urinary catheters and replace them with external devices. B. Implement comprehensive training program for healthcare staff on proper catheter insertion, care, and hygiene practices. C. Restrict the use of urinary catheters to only the most critical patients and avoid their use in routine care. D. Increase the frequency of UTI screening among patients with urinary catheters. Answer. B. Implement a comprehensive training program for healthcare staff on proper catheter insertion, care, and hygiene practices. Explanation. Proper catheter care, including aseptic techniques and hygiene practices, is crucial in preventing urinary tract infections. Implementing a comprehensive training program will ensure that staff adhere to infection control protocols consistently. While removing all catheters, option A, may reduce the risk of UTIs, it may not be feasible for all patients, especially those with medical conditions that require catheterization. Restricting catheter use, option C, could compromise patient care when catheters are medically necessary. Increasing UTI screening, option D, is important, but it does not address the root cause of the infections. Question 21. A healthcare facility is seeing an increased rate of Clostridium difficile C. difficile infections in its long-term care unit. The infection control team suspects that inadequate cleaning and disinfection of patient care areas may be contributing to the spread of the bacteria. What should the team prioritize to reduce the risk of C. difficile infections? A. Improve the facility's cleaning and disinfection protocols, particularly for surfaces that are frequently touched by staff and patients. B. Discontinue all elective surgeries in the long-term care unit until the infection rate decreases. C. Provide antibiotic prophylaxis to all patients to prevent the development of C. difficile infections. D. Limit the use of C. difficile testing to only symptomatic patients to avoid false positives. Answer. A. Improve the facility's cleaning and disinfection protocols, particularly for surfaces that are frequently touched by staff and patients. Explanation. C. Difficile is primarily spread through contact with contaminated surfaces, making it crucial to improve cleaning and disinfection protocols. Special attention should be given to frequently touched surfaces, such as bed rails, doorknobs, and bathroom fixtures. Discontinuing elective surgeries, B, would not address the primary issue of infection transmission. Antibiotic prophylaxis, option C, is not recommended for preventing C. difficile infections and could contribute to resistance. Limiting testing, option D, would reduce the ability to identify and control outbreaks. Question 22. A hospital is experiencing an outbreak of methicillin-resistant Staphylococcus aureus MRSA infections, particularly in its intensive care unit ICU. The infection control team suspects that improper hand hygiene practices among healthcare workers may be contributing to the spread of MRSA. What steps should the infection control team take to address this issue? A. Increase hand hygiene training for healthcare workers and implement stricter monitoring of hand hygiene compliance. B. Mandate the use of gloves for all healthcare workers in the ICU, even for non-invasive procedures. C. Isolate all patients in the ICU who have been diagnosed with MRA to prevent cross-contamination. D. Discontinue MRSA screening in the ICU until the outbreak is under control. Answer A. Increase hand hygiene training for healthcare workers and implement stricter monitoring of hand hygiene compliance. Explanation. Hand hygiene is one of the most effective ways to prevent the transmission of MRSA in healthcare settings. Increasing training and monitoring compliance ensures that staff follow proper hand hygiene protocols. While gloves, option B, can be useful, they are not a substitute for proper hand hygiene. Isolating MRSA patients, option C, can be part of infection control but is not sufficient on its own. Discontinuing MRSA screening, option D, would limit the ability to detect and control outbreaks. Question 23. A hospital is investigating an outbreak of ventilator-associated pneumonia (VAP) in its intensive care unit. The infection control team suspects that the pneumonia is being caused by improper maintenance of ventilator equipment. What should the team do to address the outbreak? A. Increase the frequency of ventilator equipment cleaning and implement a more stringent monitoring protocol for equipment maintenance. B. Remove all ventilator-dependent patients from the ICU and place them on non-invasive support. C. Increase the use of antibiotics to treat all patients with suspected VAP. D. Restrict ICU admissions to only the most critical patients to reduce the risk of VAP transmission. Answer A. Increase the frequency of ventilator equipment cleaning and implement a more stringent monitoring protocol for equipment maintenance. Explanation. Proper cleaning and maintenance of ventilator equipment are crucial to preventing ventilator-associated pneumonia (VAP). Increasing the frequency of cleaning and implementing a monitoring protocol ensures that the equipment is regularly disinfected and maintained to reduce infection risk. Ventilator-dependent patients (Option B) may not be feasible or necessary. Increasing antibiotic use (Option C) should not be the primary approach as it does not address the root cause of the infection. Restricting ICU admissions (Option D) would not solve the underlying problem of equipment maintenance. Question 24. A hospital has identified a rise in surgical site infections (SIS) related to orthopedic procedures. The infection control team reviews the sterilization protocols and identifies that some staff members are not consistently following recommended practices. What should the infection control team do to address this issue? A. Provide additional training for staff on proper sterilization procedures and conduct routine audits to ensure compliance. B. Restrict all orthopedic surgeries until the sterilization issue is resolved. C. Increase the use of prophylactic antibiotics for all orthopedic patients undergoing surgery. D. Move orthopedic surgeries to a different hospital to reduce the risk of infections. Answer A. Provide additional training for staff on proper sterilization procedures and conduct routine audits to ensure compliance. Explanation. Ensuring that staff consistently follow proper sterilization procedures is essential for preventing surgical site infections (SIS). Providing additional training and conducting routine audits will help improve adherence to best practices. Restricting surgeries (Option B) is not a practical solution as it delay necessary procedures, while prophylactic antibiotics (Option C) may be part of infection control. They are not a substitute for proper sterilization practices. Moving surgeries to another hospital (Option D) does not address the root cause and could negatively affect patient care. Question 25. A hospital infection control team is investigating a series of bloodstream infections (BSIS) among patients who have central venous catheters (EVCS) in place. The team suspects that the infections are related to improper insertion and maintenance of EVCS. What steps should the team take to address the problem? A. Conduct immediate retraining of staff on proper PVC insertion and maintenance techniques and implement a checklist for each procedure. B. Remove all EVCS and replace them with peripheral intravenous lines (PIVs) for all patients. C. Increase the use of broad-spectrum antibiotics for patients with EVCS to prevent infection. D. Report the issue to the CDC and wait for further guidance before taking action. Answer A. Conduct immediate retraining of staff on proper PVC insertion and maintenance techniques and implement a checklist for each procedure. Explanation. Proper insertion and maintenance of EVCS are crucial to preventing bloodstream infections (BSIS). Retraining staff and implementing a checklist will help ensure that correct procedures are followed consistently. Removing all EVCS (Option B) is not practical as they are necessary in certain patients. Using broad-spectrum antibiotics (Option C) is not a solution to prevent infections related to CVC care. Reporting to the CDC (Option D) is necessary, but immediate corrective actions should be taken at the hospital level to address the issue. Question 26. A hospital has been experiencing a significant increase in catheter-associated urinary tract infections (CAUTIs) among patients in the surgical ward. After reviewing infection control practices, the infection control team identifies that catheterization practices are not following recommended guidelines. What should the team do to address this issue? A. Provide education and training on proper catheterization techniques and implement a protocol for timely removal of urinary catheters. B. Remove all urinary catheters immediately from all surgical patients and switch to external devices. C. Increase the use of antibiotics for all surgical patients to prevent CAUTIs. D. Discontinue the use of urinary catheters in the surgical ward entirely. Answer: 8. Provide education and training on proper catheterization techniques and implement a protocol for timely removal of urinary catheters. Explanation: education and training on proper catheterization techniques are essential to prevent catheter-associated urinary tract infections, CAUTIs. Additionally, implementing a protocol for the timely removal of catheters is key to reducing the risk of infection. Removing all urinary catheters. Option B may not be feasible for all patients who require them. Increasing antibiotic use. Option C is not recommended as it does not address the root cause and could lead to resistance. Discontinuing catheters altogether. Option D may compromise patient care when they are medically necessary. Question 27. A healthcare facility is facing an increase in bloodstream infections, BSIS, caused by multi-drug-resistant organisms, MDROs. The infection control team identifies that the infections are likely being transmitted through contaminated medical equipment. What steps should the team take to reduce the risk of MDRO transmission? A. Implement enhanced cleaning and disinfection protocols for medical equipment, especially high-touch surfaces. B. Remove all high-touch medical equipment from patient rooms and replace them with disposable alternatives. C. Discontinue the use of all medical equipment suspected of harboring MDROs and provide alternative treatment options. D. Restrict the use of medical equipment to only critical care patients to minimize exposure to MDROs. Answer: A. Implement enhanced cleaning and disinfection protocols for medical equipment, especially high-touch surfaces. Explanation: the most effective way to reduce the transmission of MDROs through medical equipment is by implementing enhanced cleaning and disinfection protocols. High-touch surfaces and reusable equipment should be carefully cleaned and disinfected following strict protocols to prevent cross-contamination. Removing equipment. Option B. Discontinuing its use. Option C would not be practical and would significantly disrupt patient care. Restricting equipment use. Option D is not feasible as most medical equipment is necessary for patient care. Question 28. A hospital is concerned about the rising incidence of surgical site infections (SIS) among patients undergoing colorectal surgery. The infection control team reviews the sterilization procedures and notices that some instruments are being sterilized using outdated methods. What should the team do next to address this concern? A. Upgrade sterilization equipment to current standards and train staff on proper sterilization techniques. B. Increase the use of prophylactic antibiotics for all patients undergoing colorectal surgery. C. Perform a thorough inspection of all surgical instruments and dispose of those that are no longer usable. D. Postpone all colorectal surgeries until the sterilization process is upgraded. Answer: A. Upgrade sterilization equipment to current standards and train staff on proper sterilization techniques. Explanation: to prevent surgical site infections (SIS), it is essential to ensure that sterilization equipment is up to date and that staff are trained in the latest sterilization techniques. Upgrading the equipment and ensuring adherence to best practices is a fundamental step, while prophylactic antibiotics, option B, may be used. Part of infection prevention, they are not a substitute for proper sterilization. Disposing of instruments, option C, is unnecessary if the instruments can be properly sterilized. Postponing surgeries, option D, is not practical and could delay necessary care. Question 29. A hospital is experiencing an outbreak of Acinetobacter baumannii infections, particularly in its intensive care unit (ICU). The infection control team determines that the bacteria are likely being transmitted via contaminated equipment. What steps should the infection control team prioritize to halt the outbreak? A. Improve the cleaning and disinfection of medical equipment, particularly ventilators and monitors. B. Isolate all patients with Acinetobacter baumannii infections in a separate wing of the hospital. C. Increase the use of antibiotics to treat all ICU patients, regardless of infection status. D. Restrict ICU admissions to only the most critically ill patients. Answer: A. Improve the cleaning and disinfection of medical equipment, particularly ventilators and monitors. Explanation: Acinetobacter baumannii is often spread via contaminated medical equipment, particularly in high-risk areas like ICUs. Enhancing cleaning and disinfection protocols for equipment such as ventilators and monitors is crucial to controlling the outbreak. Isolating patients, option B, can help reduce the spread, but improving equipment hygiene is the most effective solution. Increasing antibiotic use, option C, would not address the root cause of the outbreak and could contribute to resistance. Restricting ICU admissions at option D would not resolve the issue of equipment transmission. Question 30. A nursing home has seen an uptick in skin and soft tissue infections (STIs) among residents, particularly those with chronic conditions such as diabetes and mobility impairments. The infection control team suspects that inadequate wound care and hygiene practices may be contributing to the infections. What should the team prioritize to reduce STI rates? A. Provide additional training for staff on proper wound care and hygiene practices. B. Restrict all resident mobility to minimize the risk of wounds developing. C. Increase the frequency of antibiotic administration for all residents. D. Move residents to a separate, more isolated part of the facility to reduce exposure. Answer A. Provide additional training for staff on proper wound care and hygiene practices. Explanation. Proper wound care and hygiene practices are crucial to preventing skin and soft tissue infections (STIs). Additional staff training on these topics will help ensure consistent and effective care for residents, especially those at high risk due to chronic conditions. Restricting mobility, option B, is not a practical solution and could negatively impact the residents' quality of life. Increasing antibiotic use, option C, may lead to resistance and does not address the root cause of the infections. Moving residents, option D, would not address the issue of wound care and could be unnecessary.